What is coronary angioplasty and stenting? Coronary angioplasty is a procedure of opening a blockage in the coronary arteries located near the heart. These arteries include the right coronary artery, the left circumflex artery, and the left anterior descending artery. The procedure is done to improve blood flow in the coronary arteries. Blockages made of fatty cholesterol and fibrous plaque can cause a decrease in blood flow and lead to chest pain or shortness of breath. If the blood flow reduction gets severe, it can even cause a heart attack. In this procedure, a very small tube called a catheter is inserted through a small, less than 5 millimeter incision in your groin or arm. Through this catheter, a small amount of dye is injected to identify if you have any blockages. Once a blockage is identified, another small catheter with a tiny balloon at its tip is placed across the blockage and then inflated, pushing the blockage away into the artery walls. A stent is then expanded and left in your artery to keep the bloodstream flowing well. What happens before the procedure? You're not supposed to eat anything after midnight on the day of the procedure. You should take your morning medications with only a little water on the day of the procedure, unless specifically requested by your doctor not to do so. If you have diabetes and use insulin, you may need to decrease the dose of your insulin on the morning of the procedure. If you have an allergy to the dye used for the procedure, your doctor might prescribe some medications to be taken a few days before and after the procedure. If you have any kidney problems, you should take plenty of water for 24 to 48 hours prior to the procedure. On the day of the procedure, you will register yourself at the admissions office. Following this, you will be directed to the catheterization lab, where you will be placed in a recovery area and meet your nurses and physicians. They will perform a brief assessment and examination and go over the risks, benefits, and alternatives of the procedure with you, then have you sign a consent form. You will then be escorted to the catheterization laboratory. What happens during the procedure? You will be given medication to relax you and make you sleep, but most of the time you can be roused so that the medical team can ask questions and give instructions. You are also given blood-thinning medication during the procedure. You will lie flat on your back on a catheterization table. After preparing the area in the groin or arm with antiseptic solution, you will be covered with a sterile drape. A small amount of numbing medication is injected into the skin. In the majority of patients, this is the only part of the procedure that is slightly uncomfortable. A tiny incision, smaller than 5 millimeters, will be made in the groin or arm, and a soft wire is guided through the blood vessels to the arteries of the affected area of the heart. A small catheter is then sent over the wire through a sheath. The physician will then take pictures of these arteries using a contrast dye and X-ray. Once a blockage is identified, another very fine metal wire is used to cross the blockage. Over this wire, a small catheter with a balloon at its tip is advanced and placed across the blockage. This balloon is then inflated and pushes the plaque into the walls of the artery and increases the arterial lumen, or inside space. A stent over the top of a second balloon is then moved in. The stent expands and locks into place as the balloon is inflated. It will help keep the walls of your artery open. The stent is the only thing that stays in your body. Everything else, including all wires, balloons, and catheters, are then removed. The small tube first placed in your groin or wrist is either removed at the same time or secured to the skin to be removed later that day. What happens after the procedure? You will be observed for 6 to 24 hours for any complications. You should be able to walk within a few hours after the removal of the tubes from the groin or wrist. The average hospital stay is 1 day or less. Some patients stay overnight for observation, but many go home the same day of the procedure. You may be put on blood-thinning medications after the procedure. It is very important to use these regularly as instructed. Otherwise, a blood clot may form at the site of the recently opened blockage. Avoid any strenuous activity with the leg or arm where the tube was inserted for 2 to 3 days. If you notice any bleeding, call the nurse or doctor immediately.